Hello everybody. In this video, we're going to discuss untreated sleep apnea and how it harms the heart and the blood vessels. Untreated sleep apnea, especially obstructive sleep apnea, is not just a sleep problem, it's a serious cardiovascular risk condition. Many people feel tired and ignore it, but inside the body, silent damage is happening every night. So let's break it down clearly and simply. What happens during sleep apnea? During sleep, breathing stops or becomes shallow repeatedly. Oxygen levels drop. The brain triggers a stress response to wake you up and restart breathing. This can happen dozens to hundreds of times per night. Your body thinks it's under attack every night. So, what's impact on the heart? High blood pressure, hypertension, oxygen drops, stress hormone goes up, adrenaline and cortisol they rise. Blood pressure spikes repeatedly during sleep. Over time, persistent daytime hypertension develops. Blood pressure becomes hard to control with medicine. Sleep apnea is one of the most common causes of resistant hypertension and is only those patients require 3, 4, 5 blood pressure medicine. Heart attack and coronary disease. Repeated low oxygen causes inflammation, oxidative stress on your body, damage to arterial lining leads to plaque buildup in heart arteries. Untreated sleep apnea significantly increases heart attack risk. Heart rhythm problems, arrhythmia. Sleep apnea increases risk of atrial fibrillation, bradycardia, which is slow heart rate at night, and dangerous pauses in heart rhythm. Many patients with a recurrent atrial fibrillation improve once sleep apnea is treated. Heart failure, increased pressure in chest, increased workload on your heart, oxygen starvation of heart muscles. Both right-sided and left-sided heart failure risk goes up. What's the impact on blood vessels, vascular system? Stroke risk, blood pressure surges, inflammation of brain arteries, increased clot formation. Untreated sleep apnea can double to triple stroke risk. Pulmonary hypertension. Low oxygen causes lung arteries to constrict and repeatedly, and over time it leads to high pressure in lung and causes pulmonary hypertension. The pressure inside your arteries of your lungs becomes much higher, and that causes right heart strain and failure. Atherosclerosis, which is hardening of arteries. Repeated oxygen deprivation damages blood vessels endothelial lining. It accelerates plaque formation, affects heart, brain, kidney, and legs. Why this happens? The core mechanism. Sleep apnea causes repeated oxygen drops, chronic inflammation, hormonal stress response, insulin resistance, and endothelial dysfunction, which is blood vessel lining. This combination is toxic for heart and blood vessels. So, what are the common warning signs often ignored? Loud snoring, breathing pauses witnessed by partner, morning headaches, daytime sleepiness, poor concentration, high blood pressure despite medication, weight gain, or insulin resistance. Good news, the treatment reverses risk. Treating sleep apnea can lower blood pressure, reduce heart attack and stroke risk, improve heart rhythm stability, improve energy, focus, and metabolism. You have treatment options: CPAP, APAP therapy, oral appliances in selected cases, weight loss, positional therapy, avoiding alcohol at night, and treat your nasal obstruction. CPAP therapy is one of the most powerful non-drug cardiovascular treatment available. So, untreated sleep apnea quietly damages your heart and blood vessels every night. Treating it protects your heart, brain, and life expectancy. If you and your partner has snoring, daytime fatigue, hypertension, heart disease, screen for sleep apnea. If you like my video, share it, subscribe it, and repost it. Thank you for watching. I'm Dr. PK from Dr. PK Life.